In this lesson, we are going to talk about mood disorders. Now, specifically, we're going to look at bipolar disorder and how to assess and care for these clients. But first, let's just define mood. Mood is a long-term emotional state. It's not just what you feel right now, it's more long-term, more all-encompassing than just simple emotions or feelings. Under normal circumstances in a client who doesn't have bipolar disorder, our mood may swing a little bit, but we're relatively able to regulate it, keep it pretty close to baseline all the time, especially when it comes to our long-term mood. But not everyone can regulate this as well, and they may really struggle to keep their mood at baseline. So this is not just when someone's like happy 1 minute and sad 10 minutes later. It's much more invasive than that. So let me kind of illustrate what I'm talking about when I say regulation. So if this is normal, this is our baseline, and of course normal is relative. Let's say something really great happens, like you ace a test. Okay, or you're getting married, your mood is going to elevate, right? You're happy, you're going to come up here for a little while, maybe even a few days, a week, maybe longer, and eventually you'll kind of, come off that high and come back down to your baseline, right? Same thing if something sad happens, maybe you don't do as well on that test, or you go through a bad breakup, your mood is going to go down for a little while, and you'll stay sad. But then over time, you're going to be able to kind of self-regulate back to this baseline mood. So mood disorders occur when someone really struggles and has a difficult time regulating back to baseline, or when they have extreme versions. So instead of their happy being here, their happy is way, way up here. Okay, so they're overly excited, they probably aren't sleeping, they spend money they don't have, they could work for days, and they just feel so good. This is called mania, okay? Their highs are incredibly high, and they really struggle to bring it back down to, a normal, healthy level. And honestly, you just can't live like that for very long. And so they could even have, hallucinations and delusions, and they just kind of hover in this really high mood level. Now, the other thing is that they could swing to the other end and have these extremely low lows. And so they come down here, they're possibly sleeping all the time, they're eating a ton, or they're also not eating. It's just an extreme sadness. Now, it's okay to be sad, but when you really struggle to self-regulate and you end up kind of hanging out in this low mood, you really can't live like that for very long either. And so our goal here is to be able to move this person back into this kind of manageable level of mood, these manageable changes from highs to low. And so for the purposes of this lesson specifically, we're going to focus on mania. And then in the next lesson, we'll explain depression in more detail. So when we talk about managing mania, we usually are using medications. We can use anti-anxiety medications like benzodiazepines, especially in the acute phases or during a hyperactivity state of mania. But the most common medication that you're going to see for bipolar disorder is going to be a mood stabilizer called lithium. Now, there is an individual lesson on mood stabilizers and lithium in the next module, so make sure you check that out. Now, as far as interventions, safety is always number one. Do a self-harm assessment. Ask if they have a plan to harm themselves or anyone else. Remember that they could also even be having hallucinations or delusions. And so it's really important to orient them to reality and help them to stay in reality. Either way, you don't want to argue with them. And then with any interventions that we do, we always want to start small and with something simple and then progress. So this might mean starting with one-to-one interaction and progressing to group therapy, or maybe start with small, quick, easy to complete tasks and then progress to things that are a bit more complex. So this just keeps them from being overwhelmed or feeling any sense of anxiety or failure. Now, in terms of some practical things that we could do for patients who are experiencing mania, is to promote regular sleep-wake cycles. We want them to sleep at night and be awake during the day, even though their condition is trying to force them to kind of stay awake at all hours. We also focus on good nutrition. Now, here's something I actually remember from nursing school as being a question on multiple exams, and that is high-calorie finger foods. Why do we care about high-calorie finger foods? Well, we want to provide something that they can easily grab and go and eat while they're walking around. A lot of times these patients will just pace back and forth in a room. They're not going to stop to sit down and eat a meal. And so we give them high-calorie finger foods so that they can just grab them and pace back and forth and actually get the nutrition that they need. We also want to promote appropriate clothing choices. Now, sometimes during manic episodes, clients may make some choices that they wouldn't normally make in their baseline state. So we just want to encourage them to wear things that are appropriate for whatever situation that they're in, especially if they're in group settings. The other thing we promote during mania especially is gross motor activities. Those are things that involve your extremities. So things that actually involve moving your arms and legs. So we're talking about walking, running. We could even say swimming. Of course, if you're in an acute, inpatient environment, that might not be possible. But when they're at home or in an outpatient setting, that might be something you can promote. But a lot of times, this is why you see us allow patients to pace in their rooms. Pacing is walking, isn't it? And so we allow them to pace. We might allow them to pace up in the hallways. Just be kind of cautious of letting them pace in a day room with other patients, because it might actually be a trigger for anxiety for other patients, and then it becomes a safety issue. So just keep that in mind. So, okay, priority nursing concepts for a client with mood disorders would be safety, of course, always. Mood affect, because we want to determine kind of where they're at. Can we get them to that manageable state? Now, in your outline, I put coping, which is still true. There can be some underlying anxiety, so it's important to give healthy coping strategies. But one of the things I've seen most often in clients with mood disorders is they're either not eating or they're eating everything in sight. Not to mention, when they aren't eating and they're extremely active, it can cause some serious, dehydration and malnutrition issues if it goes on for too long. So we do want to make sure that you focus on this part as well. So let's recap. Mood is a long-term emotional state over a period of time, not just an instantaneous emotion. Clients with mood disorders tend to have difficulty regulating their moods. They find themselves experiencing these very high highs and very low lows. As far as medications, specifically for mania, we use anti-anxiety meds like benzodiazepines and mood stabilizers like lithium. We make sure they sleep appropriately. We give them high-calorie finger foods. We help them choose appropriate clothing choices, and we perform those gross motor activities like walking or running. And of course, always safety first. Make sure that they are oriented to reality as much as possible. We don't argue. We want to ensure they're not going to harm themselves or anyone else.
Thanks for watching another nursing.com lesson. Click the link below in the description to watch thousands more lessons over on nursing.com. Also, be sure to hit the subscribe and the little bell to make sure you're reminded when new lessons come out. And if you want to just keep watching more lessons, go ahead and click this video over here to continue learning. Like we always say here at nursing.com, happy nursing.